Hello, everyone. It's Dr. David Janarious, joining you on another After Hours Clinic podcast. As you can see, I'm in a different location today. For those of you viewing, I'm in a hotel room in lovely Park City, Utah, where we are doing our best to take advantage of what remains of the snow after the ravages of global warming essentially destroyed the snow season out here. It's really fascinating. We come out here, once a year on an annual sort of family trip. And it's odd when we came out there and you actually see the mountains are green and not white. But despite that, it's actually still pretty good skiing. I'm having a blast out here. That being said, I still wanted to do a recording while I was here because, I like to get in the habit of doing things. The more you do things, the easier it becomes. And so I didn't want to fall out of the habit of doing it. But I also didn't want to talk about something too heavy today. So I thought I'd bring up an article that I found in the medical literature that I just found interesting. I'll go ahead and pull that up real quick. Okay, so this was published in JAMA recently, in March, I believe. The title of this article is Psilocybin or Nicotine Patch for Smoking Cessation. And it is exactly what it sounds like. They took smokers who had basically tried and failed at quitting in the past, split them into two groups. Half of them received a nicotine patch therapy to help with smoking cessation. The other half got a single dose of psilocybin, which is, for those who don't know, is the active ingredient in magic mushrooms. And they basically followed them over time and, assessed at 6 months what percentage of them, quit smoking and had sustained remission of smoking at that 6 months. And, without bogging you down with too much of the details of the study, the punchline is psilocybin was the clear winner. And in fact, they found that those who used the psilocybin were 6 times more likely than those who used the nicotine patch to have quit smoking successfully at 6 months. So on its face, this sounds like a big win. And I'll be honest, I wish this stuff had been published in my younger, stoner days, my teenage years, because it would have been so cool. It would have confirmed every kind of teenage brain idea I had. Yeah, man, this whole time it's been the government and big pharma trying to keep us from psychedelics. They knew that would heal us, and the man doesn't want us to be healed. The man wants us to be sick. And the man definitely doesn't want us to rock and roll. But in all seriousness, the general feeling toward both smoking and psychedelic use has kind of turned on its head in my lifetime. When I was a kid, you basically could buy cigarettes from a vending machine. Every grocery cart had Joe Camel smoking a cigarette on the front of it. And, the thought of using, marijuana, psychedelics was just not unheard of, but it was certainly frowned upon, obviously illegal in all 50 states. And we've seen the tide turn, particularly with marijuana. We've seen, I think roughly half states have legalized it, or if not more. There's a couple states that have actually decriminalized magic mushrooms, so I think Colorado and Oregon. And there is a sort of renewed interest in utilization of these kind of what were formerly recreational drugs for medicinal purposes. Obviously, I think marijuana deserves an episode on its own, but there has been this interest in psilocybin particularly in the mental health space. So there was an earlier study published in the same journal that looked at people with moderate to severe depression compared using an antidepressant to a single dose of psilocybin. And in that case, it was, psilocybin was the clear winner. So again, there was another kind of signal from another small study showing that perhaps we would, actually patients with moderate to severe depression may actually benefit from a single dose of psilocybin, similar to this experiment. It is exciting on its face, right? Especially because things like major depression, smoking, those can be really challenging to treat. So whenever there's something new, our tendency is to get excited about them. I will state, though, there are some serious caveats. and getting too excited about a study like this. First off, a tiny study. This is like a study of 80 people. So 40 in each group, basically. So obviously, such a small study, it's hard to generalize to a general population. But also, it tends to be, potentially very biased population that they studied. First off, they were on the younger side. They were 90%, if not roughly 90% white. And interestingly, 60% of the people in that trial had prior experience with psychedelics. The average, I think, across the nation is like 10% or something of adults have prior experience with psychedelics. So, obviously this is like perhaps a biased and motivated population that's interested in psychedelics and their potential. So this is the actual design of the study. And, what you can see is they took the two groups. They assigned half of them, they basically assigned half of them to the psilocybin group and half to the nicotine patch group. Leading into the week 5 where they actually were given their treatment assignment, they didn't know what they were going into. They didn't know if they'd be assigned to the psilocybin group or the control group, in this case, the nicotine patch group. And so I imagine that, after weeks 3 and 4, when they made the assignment, there was 40 people who were quite pissed to receive a nicotine patch. To the extent that they actually offered those in the nicotine patch group a dose of the psilocybin at the end of the trial, just so that people wouldn't, basically bail on the trial, being like, hey, what the hell? But I found that interesting. And obviously, speaking to the fact that, psilocybin is something that's hard to have, like, a blinded control, meaning like those who are in the psilocybin group, they know they're not getting placebo. So it's, it is hard to write off necessarily the placebo effect of this intervention. So that was just an aside, but I did think that was funny. Just the idea that you'd show up to get some mushrooms and you'd end up getting a nicotine patch. I know if I was like in my teens and 20s and signed up for that, I'd be pissed. But anyways, yeah, so small study, not blinded, very biased population. But, let's look at this from the bottom line. Do I think that this is something that I would consider for a patient? Putting aside like the legal, aspects, and it's a Schedule 1 medication. I can't prescribe it. So for those of you watching and kind of hoping like, no, unfortunately that's not possible. I can't prescribe it. But let's say in like a magical word, I did have access to it. Would I consider it? And the truth is, yeah, 100%. Why? Because again, as I've mentioned, things like smoking cessation, very hard to treat. I mean, without the aid of smoking cessation medications, smoking quit rates for any given attempt is roughly like, 5 to 10% or some abysmally small number. Even with the best of the FDA approved medications out there, the success rate climbs to maybe like 25, maybe 30% at the highest. With some of the more potent medications out there like Chantix, which I'm sure a lot of you have heard about. Even with that medication, you're looking at 25, 30%. So having another tool for patients who have failed multiple things would be in and of itself interesting, because it's very common that people who have tried quitting smoking have failed nicotine patches and gums. They've failed, Zyban for smoking cessation. They failed Chantix. So what are you left with? So again, having another tool that works in a different way, has a different mechanism of action, I think in and of itself is interesting. And then we have to look at the potential harms, right? When we look at the potential harms of mushrooms, although they're Schedule 1, legal drugs, the relative harms are actually pretty low. We know this because people have been using mushrooms for centuries. And what we know about them is to my knowledge, there have been no deaths related to mushrooms, at least not directly from, toxicity from mushrooms. I'm not aware of any long-term toxicity, like organ toxicity, liver, kidney. The major side effects would be mental health. Obviously, if you give a psychedelic to someone who's predisposed to psychosis or mania, it could potentially trigger that, and there have been rare cases where that's occurred. When you take mushrooms when they're first kicking in, it does put a strain on your cardiovascular system. It increases, heart rate, blood pressure. And in fact, in this trial, the one significant adverse effect was a guy who had his blood pressure spiked and had to be given medication. So, again, for patients that may have heart disease, which is a lot of patients that overlap with our smoking population, right? A lot of our patients who are smokers also have underlying heart disease, potential downside to utilizing this medication. But that being said, I do think there's a large portion of the population that could tolerate a single dose of psilocybin quite well without any major issues. Obviously, it'd have to be done in a monitored setting. But yeah, if I had a patient with, cessation issues that was totally unable to quit, 100%, I would consider this, right? If, for depression, that's another big one, right? When patients have severe depression, they want to feel better like yesterday. And most of our first line medications take up to 2-3 months to really work. So the option of treating someone who is really suffering with a single dose of medication and getting a robust response does seem promising. Unlike something like ketamine, for example, it doesn't have the same level of toxicity. Meaning you're not going to overdose on it, or pass out in the hot tub and pass away too soon. Rest in peace to Matthew Perry. But yeah, so I think there's promise there. I think we should probably reschedule these medications so that we can research them. Because although these are small bias trials, the signal from these trials is strong enough that it warrants further investigation. Who knows, maybe teenage me knew something that was ahead of its time, or ahead of my time. But maybe not. Either way, I hope you found this interesting. I definitely found it interesting. If you have questions or comments, please leave them. Comment on this video. I'll definitely do a follow-up if it's a good question. I really look forward to doing this again in the near future, and I hope you'll join me.